Hello everyone, I'm Dr. Francisco. This is the bite-sized information for kidney patients to try to help them to know more about kidney disease so they can manage their disease better alone as a self-care or with their own doctor or with me if they choose me. So today I'm just going to discuss very casually. It is a delicate and topical topic. I probably was going to discuss it, but just because there have been some participation in the previous presentations talking about mindset, about why people don't do go for life donation, why some people go and buy a kidney, etc. So for that reason, I just decided to do to share something. So I'm going to share some facts. I'm going to share my opinion as well. That is the opinion shared by most professionals, actually, kidney doctors, transplant doctors, and I'm also going to let it for you to reflect, because we're going to discuss about ethics. No, about ethics is something, is nothing totally written. It's something evolving. We're still, evolving on our ethics. We are not, in many aspects, into the highest possible standard, because ethics are related to what is right. And what is right for every person, for every community, for every government, for every part of the world might be different. And also depending on the circumstances. So it's something very complex, but like everything in life. So there are things that actually many people approach something in a different situation. For example, a kid just alone walking next to the swimming pool, as you can see, a swimming pool. So some people will just won't intervene. Some people will just go and grab the kid and avoid the kid goes to the swimming pool. Some people will just stay put until something happens. Maybe the kid never falls into the swimming pool. It will do something once the kid falls into the swimming pool. And some people even won't do anything, even the kids fall into the swimming pool. No. So people will do different, and there will be many also reasons why. Some people might not jump into the swimming pool because they might not bother. Sometimes they might not go to the swimming pool because what if I do the things wrong and then I'm going to be blamed, or I don't even know how to swim, so I'm going to try to save someone when I don't know how to swim. So in a way, there are many reasons behind. So in a way, sometimes the right thing to do is not just straightforward black and white. And as I'm telling you to self-reflect, I also ask you to observe and go beyond what it is obvious. Because at the end of the day, this is a very delicate, very topical. It's about right or wrong. It's about certain labels, judgment, etc. But the reality is, like at everything in life, you need to take a stand. What is your stand? What is right for you? If I see a kid, I would probably just suddenly go and try to avoid the kid, or I will shout to the father, the kid, or something like that. Or the kid drops and there's no one, I will just jump. I know how to swim, etc. No, so everything is depending what you think, what you know, what can you do, and what is in your heart as well, and what is your upbringing, what is your knowledge, etc. So I'm just putting that simple example just to illustrate that the ways to proceed and the reasons why to proceed or not to proceed could be very different. And someone might not do anything, but because otherwise he also will pull himself because he doesn't know how to swim, or sometimes maybe a parent won't see the whole picture and say, oh, you pushed my kid. So that's why many people are afraid of those things. But at the end, depends on what you have inside here and inside here, how you think, what is your upbringing, what risk you want to take. I see a kid, I can say, yeah, I mean, the kid just jumped, so I just went to save the kid. So even the parent can say that. At the end of the day, there are cameras, etc. No, but there is always interpretations and misinterpretations. So I'm just telling you that background. But at the end of the day, you need to take a call in life. When you take decisions, when you approach life, you have your own ethics. So you need to apply your own ethics in this aspect, no? So we're talking about commercial transplantation. So commercial transplantation involves that a patient or recipient gets a kidney donated by someone that is not related to the family or friend, someone that didn't do it out of altruism, and either do it because some degree of dependence, some authority over, some economical gain, a transaction, some coercion, or sometimes could be even, a threat, etc. No, so there is typically a commercial interaction. The donor receives some money. There is a intermediate, a broker that earns also a big money, and the recipient receives the kidney and then get a kidney transplant over continued analysis. But it is devoid of the beauty of donation and transplantation, what I mentioned in the last presentation, that it is the altruism, being a gift of love, being a gift of life, etc. So that's one of the drawbacks of commercial transplantation. And an important drawback is what happens to the recipient and what happens to the donor. So there is a lot of data that many donors actually struggle after donation, regret after being donated, after donating in some circumstances, for economic gain, and even advise other people not to do it. And it's actually most of them in those surveys, etc. Why is like that? Because indeed the donor might receive just short economical gain, maybe a big sum of money. Sometimes even they have been in the news that people donate a kidney for an iPhone. That is quite sad. But receive a lump of money. They might see it as a big amount of money that probably will help them pay whatever debts they have, or maybe buy something. But that money is going to go. It's just like, as the saying, to give fish to someone or to teach them how to fish. This money is going to go. It's going to expire. And at the end of the day, the person will end up with no kidney, with the money gone, probably bad spent, or just not enough to hold the rest of their lives. And typically the donors are not someone like your brother that you are going to, oh, how are you? And then you say, hey, you need to stop smoking, and you are taking care of that person. You know what is going on, goes to the checkups, the doctor, advise them on lifestyle, diet. They were well informed about the pros, cons. They took the best decision out of love, etc. The commercial donors, typically, they don't know much about that. They just know that, okay, I will receive some money too, but they don't know exactly what are the risks of kidney failure, dying, developing progressive kidney disease, hypertension, protein in the urine, especially that they are usually people that are on their socioeconomic circumstances not very good. And is that desperation what pushed them to donate a kidney? And it is, you can understand and you can feel for them. I feel for them. I understand them. There's a lot of people that has been contacting me trying to sell the kidneys or me be an intermediate. I just simply tell them that I am not involved. I also tell them that, that is probably not the ideal thing to do, because that happens. Many donors have regretted, and many donors, because they are not really going to continue follow-up, no one takes care of them, they maybe develop another disease and the kidney can spoil. Imagine if the kidney spoil for them, they probably develop kidney failure in a country that maybe they cannot manage well kidney failure, and probably their life will be gone. So that's what really happens to many of the donors. The economic situation, on the contrary, worsens after donation. If they become ill now, they cannot work. They cannot know even odd jobs. So indeed, they are in a desperate situation. But at the end of the day, yes, the situation is very bad, has been bad all the time. But it's better to probably look for odd jobs, etc. Because at the end of the day, it's a big risk. They're not going to be managed properly, not going to be managed by a doctor like me. They are forgotten, simply forgotten. Gods know what happens to them, and many times not nice things. So it's not like, the recipient is going to be paying attention to them, like if it is your brother who donated to you, or a doctor following the recipient and following the donor. So they are forgotten, basically. Also, this scenario commercial transplantation is not done in my hospital, no? In the, the largest and most specific hospital in Singapore, with all the facilities, etc. It's not done there. It is done in a garage, in a hospital out of working hours, when all the facilities are not in place. Probably the process has not been done properly, etc. No? So that leads also to complications for the donor. Has to be done in a rush, has to be done nervous because it's a secret thing, etc. All that is not a good environment. And the same happens to the recipient. I also typically, people contact me online, etc. Then I share those things to the donors. But, some of my patients throughout my career have, consulted me about this. Obviously, I'm not involved, but I do what I think is right. That is, put them the same picture. Yes, indeed, what happens to the donors, but what can happen to them? Indeed, the surgery is not done probably done properly, but in a rush, in an environment that is not correct. Sometimes many of the recipients have a lot of surgical complications, or sometimes they come back with infections, or even with hepatitis C or with HIV. And also the recipients, maybe the compatibility was not properly assessed. And sometimes they have more chances for rejection. There is research that shows that the transplant actually lives shorter, and they're more prone to complications, that sometimes even more than deceased donors, or and definitely more than a live donation. So I've seen cases that the kidney function when after the transplant was not that great. Probably the donor quality, the quality of the donor, the kidney, the donor probably already was a little bit ill, so in a way gave a kidney that was already ill, so the kidney function didn't improve that much after transplantation. So I have seen cases that almost die because of severe complications. Sometimes they over give medications. So it seems to be overall not the best outcomes for the donor and for the recipient. For that reason, it's not only Francisco, it's most of the kidney doctors, most of the nations that encourage not to consider this sort of transplantation, encourage to not to be involved, patients, doctors, donors, people, to be involved in sort of transplantation, as I mentioned, because it's devoid of what is the beauty of transplantation, the altruism, the love. It can lead to a lot of complications to the donor and a lot of complications to the recipient. Indeed, there are successful cases, no? Recipients that eventually tend to live more, but I have seen a substantial amount of complications soon or later for this type of transplants compared to other transplants when all the process is done properly, with all the matching, when everything is discussed. Also, the well-being of the patient, the well-being definitely of the donor, the aftermath, those ethics running in your mind is of the mind and the donor is much better with the other types of transplantation. For those reasons, most doctors, most authorities tell their doctors, tell their healthcare providers to discourage patients to go for that because it's not the best outcome. And there are many other options. There is the option of dialysis is one, indeed not a great one, but it is. If you, as I repeat always, if you live a frugal and healthy lifestyle, you can live many years on dialysis, or you have more chances to live many years on dialysis. And there is the option of deceased donor transplantation. There is the option of live donation, that at the end is the best, no? But what are the factors then involved into that? There is a lot of factors that sometimes push the donors, as I already explained, the economical situation, the desperation, needing to feed the relatives, but at the end they will feed them for a short period of time. But what happened to the rest is what they don't see, and no one tells them that, you know. And for the recipient, then maybe they develop a complication, significant complication. The life of the transplant is going to be, you know, potentially shorter than or more chances than on the other ones, or maybe they can come back with an infection, like even HIV or something like that. No, it has happened. So, but what pushes the recipients to consider that at the end, as I told you, can be very complex, the situation with the child on the swimming pool, and we might not see the whole picture. Also, we're not seeing many recipients also, you know, in a situation that they feel pushed to do that, no? They will think I have a family to feed. If transplant will give me the opportunity to continue, I don't have any live donor to donate to me, either willing or healthy to donate to me, or I don't want to take from my family, I don't want to give them the risk, etc. But I have a family to, so in a way, and there is probably the waiting list is very long, and maybe like in Singapore, like 9-10 years. So in a way, they just say, oh my God, I need to, it's not just queuing in you know, it's 9-10 years, and sometimes can be even more. So it's a lifetime already, when we know that the lifetime of patients with kidney failure, total kidney failure, can be shortened. So it's difficult to wait, because in the way, while waiting for all that, many things can happen, and maybe you are suitable for transplant at year 2, but if something happens at year 3 or year 5, you that having a heart attack, and then you miss the chances to have your transplant, because now you lose your fitness, because the transplant surgery is a major surgery. You need to be relatively fit to undergoing. So it's a little big gamble. So when there is no available donor, when there is no willing donor, when there are a lot of fears about living donation, when there is a long waiting list, many patients indeed feel pushed to do that. So that's why also you cannot be totally judgmental. I advise my patients, that is my opinion, what most doctors think, what I believe, because of those benefits, and I let them to reflect what is the best medically or ethically to do. But I tell them what happens to donors, what can happen to patients, and then they decide, and I'm not involved. So many patients eventually come back with the transplant already done, so I need to take care of them, or I didn't participate, not encouraging, nor participate in the process. Simply, it's a patient, I need to continue taking, because no one is going to take. Those guys that did the transplant, they're not going to take care of my patient. He's my patient, I need to take care of my patient. That's the reason. that is not what some people say, like that's condoning. So many, people indeed discourage people not to go for transplant. When they come, they just treat it as normal. Some people say that is condoning, but also, what are you going to do? Is your patient, the patient needs care. You're not going to, for whatever circumstances the patient decided to do that, you still need to treat with, as your patient is your patient. It doesn't matter what happens. So that's why we don't need to be judgmental. I just have my opinion, I share it, and I leave the decision to my patients. If they go, hopefully nothing happens, and I will guide them from then onwards to try to, to everything to be fine. But I don't promote, I don't also condone it. I just simply do my duty as a doctor, that is treat anyone, and that's it. But I have my own personal opinion, and I know the medical facts that I have just shared with you, and that's what I tell my patients, and it's up to them. But sometimes they feel pushed for those circumstances, like the circumstances of, it's not just the person or the needs, also the social and the culture, the mindset of the person, the mindset of the culture. As I told you, depending on what you think, regarding mindset, I have, heard people that say, oh no, I have money, why I'm going to put at risk my relative. That's a strong mindset on that aspect. So in a way, it's difficult. I'm going to say if that's the right or wrong, but you probably mind what I think of that. But if that person thinks like that, so it's very difficult that that person is going to go and have an open-minded for live donor transplantation. But if someone doesn't have that strict mindset and say, okay, so a little more open, or decide to open his or her mind after hearing all this, even that they know there is opportunity for go for commercial transplantation, when they know that something wrong can happen to them, and they maybe will endangering someone that is just on the need and will become even in a worse need in the future, and that person will regret. Even they have surveys that say that the donor eventually end up hating the recipient for going into that process, which is quite it can get in the heart, I guess. So in a way, but if you are open-minded and you say, oh my God, yes, maybe I will bring some risk for me, or maybe I will bring risk to the other ones. Now is the two, or maybe something goes wrong, or at the end of the day, maybe indeed, if even it's better for me that I ask again my sister to donate, or my wife. And actually, what Dr. Francisco say the other day, this slogan of keeping us together for longer, also the mindset of saying, the donor is gives everything, is sacrificing, the recipient is receiving everything, promotes this sort of mindset that, oh, I'm not going to put at risk my family, I'm going to, just because I have money, I'm just going to go and buy a kidney, because you have that mindset that's also created by people that see just this transaction as a transaction, that the donor gives a gift to the recipient just receive everything. I discussed this very, very detail in the previous video. The recipient feel like this a little bit selfish, and the donor feels that doesn't gain anything, because many people see like that. Donor gives, recipient receives. But as I explained to you in the other video, it's not true. The donor receives a lot for benefiting the patient, because if that patient is the wife, the donor will have a wife for longer, and all what that means. That I encourage you to see the video if you have not seen before, so you understand this with more detail. But then when you start opening your mindset, start thinking differently, when you say, okay, indeed, the live donation is better, indeed, I can put myself into more risk. If I go and buy a kidney, I will put another person that I don't know at heightened risk. And at the end of the day, it's true, I will be better off with a live donor kidney given by my sis, or by my wife or my husband. And indeed, I will receive greater benefits. She will receive also the satisfaction plus other benefits to me being for longer, especially when I mentioned that people are receiving these live donors out of love of altruism tend to live better and longer with less complications than the commercial transplants. So when you put all that into perspective, it can also shift the mindset, no? Especially when you give some evidence. For many of the things I'm discussing with you, so many doctors in their clinics don't have time, or they simply don't discuss it, don't go into that because there is the next patient, the next patient, the next patient, no? But when you start, being more discerning, put more thoughts in the situation, put more open mind to all this, and at the end realize that those decisions have consequences for you in your body and in your future mind or your ethics progress, then you might decide otherwise. Although indeed many people indeed feel very pressed about all this. So that's why I feel for the donors, I feel for the recipients, because the situation is not simple. The waiting lists are huge. Sometimes there is no donor, or the donor is not healthy, or the donor is not willing. That is fair, or simply they don't want to give the risk. But I told you, the thing is, try to address why. The important question is why you have a no against live donation with someone in your family. Why yes for the other one? When you start addressing the why, and sometimes you might discover that actually it's not well founded. It's just simply the culture, because you heard something, because it's the simplest option, because it's the shortcut. But sometimes shortcuts leads to big consequences, either physically or morally. So that's why I invite you to put more greater thoughts on that. And for all those reasons, it's not just Francisco. Nations have even, joined together to even do a declaration that is called the Declaration of Istanbul in 2008, and there have been some, follow-ups on that to try to join together and discourage commercial transplantation, etc. No, for all those reasons, and even in some countries is considered illegal, and it is even persecuted. So you need to be very aware of all those things, no? As I told you, ethics are very complex. Every situation is very different. We understand that there is a lot of external drives, not ideal, but at the end of the day, we need to live with the decision and with the consequences of that decision for the rest of our lives. I'm just sharing my opinion that is shared with most doctors, explaining why we think like that, and also telling you that we feel for all the parties involved, your families, and at the end of the day, irrespective of what you decide, we are not judgmental. We simply just have an opinion and we have an advice, and that's it. For many of those decisions have been pushed for a mindset that was maybe wrongly created upon us by what the media says, what some fears, but sometimes those fears might be totally unfounded. Like, okay, my wife might die, etc. Indeed, there is a risk of that, but it is around 3% sorry, not 3%, so 3 in around 10,000. So in a way, it's not huge. Indeed, there are other complications. So but sometimes those fears are heightened for things like, or for just one single story. Oh, someone donated and died. It's very sad. It's true. But the truth is, most people actually do better after donation, and most donors do well, and most recipients do well. When you really start seeing the facts, and open your mind, like actually living donation is not too bad. It's not indeed a total benefit for recipient. The donor also will receive more time of a husband paying bills and etc. If the wife gives a donation to him, the wife will have a husband for longer, will have a father for the children for longer, etc. No, and a happier one. So it's more complex and it's not very obvious as well. And I advise, many people about all these online, in consultations, especially when I was working in government hospital, seeing an enormous amount of patients. But many of these fears are the economical fears, like what would happen if something happens to my family. Also because there is not so much protection, as I mentioned, for the donors. Also tend to people to refrain to donate. There is not so much insurance or subsidies that if something happened to the donor, okay, don't worry. If you develop kidney failure, the government will pay for that, or your insurance will pay for that. So not many governments are so gentle and kind on those aspects, and those are deterrents for the donors and propitiate go for the shortcuts. So it's a more complex situation that it has to have a multi-pronged approach, but without understanding what are those triggers, what those causes, what is behind the mind of the donors, what is behind the mind of the recipients that feel pushed to do that, is very difficult to solve this situation. It will just carry on without really trying to solve something. Like, indeed, you want people to donate, so make a channel, smoother for donation. Kill off, destroy those worries as much as you can. So like people have confidence in donation, have at least faith that if something happens, you cannot be totally sure that everything is going to be fine, but have faith that if something happens to them or their families, or they will be protected. Or if something happens, like could be even as bad as death, their families will be protected. There will be a grant for a school, a grant for medical treatment, housing, etc. Because someone sacrificed. Now in that case, we can call it a sacrifice for a good deed, his life, and put himself into the risk. Like if governments, insurance companies are pro-donation in the right track, then many of those fears that are the fears that most of my patients have shared. What if something happens to me? What will happen to my family? I cannot risk my family, or I cannot risk my sister. What will happen to her children? But I have compared to what in other countries happen, what supposedly are less family-oriented countries, but because the government pays for everything, because the government, exalts the donor, protects them if something happens to them, they don't have to have that worry. You say, oh yeah, my sis, okay, let's donate. I hope that the doctor told me that very low chances. If something happens, I know I'm protected. I know my family will be protected, so let's go. So I have seen such a cool responses because there is different circumstances. So many people just focus on trying to change the mindset of the donor, but it's a multi-pronged, or the recipient, it's a multi-pronged, or the doctor, it's a multi-pronged. We need to change the culture, we need to change the mindset in the community, we need to change the benefits, we need to change the channels, we need to make easy for the people to go in this way, rather than out of fear, out of desperation, out of not knowledge, of just not knowing what are the options, or what are the pros or cons of every option, or why this option is good or bad, because not being well informed. And is the doctor role to inform their patients Why this group exists, because I have seen so many of my patients tell me, oh, my doctor never told me anything of that, or my doctor never discussed about transplantation, or my doctor doesn't have time to do that, or I always spend the time my patients deserve, the situation deserve. So that's why I created this, to give you better informed. Information is on your side all the time. But at the end of the day, you need to use that information properly. But if you have no information, if you have misinformation, if you have the wrong or halfway information, the decisions, the choices you take could be shaky as well. But when you have more solid information, when you decide to ask your question, first of all, ask me all the questions. I'm talking about this, like that, because some people start asking some questions that are totally fair, and those are the questions that many of my clients and patients ask me, that many of the questions that you have, or sometimes, oh my God, yes, that's important point I have not considered. That's why we exist. That's why this group exists. So for that reason, please give me thumbs up, like, so show me that my advice. You might not need to agree with everything I say. You don't need to, because I told you every mind is different. But at least what I want you is to open your mind and consider other options, and start weighing differently, with a different balance, with an unmanipulated balance, that's information, right information, your choices and your decisions. At the end of the day, I want the best for you. Even I am your driver or someone else, but I just aim to give you information, and then you discuss it with your own doctor. But my contact is there if you want me. I'm happy. At the end, remember, everything is in the mindset. I have my glasses here, so let me see if there is any question. No, a question now, but if there is any comment or question later on, I'm happy to. This is a delicate topic. Many people, many doctors are afraid to talk about it. When you want to change the world, you want to create something better, you need to have a little bit of guts and talk from your heart. And I hope you guys catch me. I give my opinion that is shared by most doctors. I aim not to be judgmental. I hope it transpires like that, because I have patients that I have understood the situations, desperation for all the circumstances we discussed, they have and go and buy a kidney, or patients that, or donors that have sold the kidney. So I treat them equally. For me, it's just a patient that wants my opinion. I don't judge, because I don't understand fully the circumstances. But when I have the chance, before that happens, I just share my opinion, because sincerely I believe it is on the betterment of their health, physical and mental and medical, and for the donor, if they were to reconsider the option of live donation. After I told you that at the end, live donation is not as bad as people think. All the people around the donor recipient will receive a benefit, and the donor itself as well, beyond the gratification of donating out of love. So just open your mind to that. Dr. Francisco, wishing you the best possible health. Take care. Bye-bye.